You are working with a communications specialist to develop a communication plan for your district. Together, you have identified some key strategies for engaging communities to improve coverage. You are working with a communications specialist to develop a communication plan for your district. Together, you have identified some key strategies for engaging communities to improve coverage. How will you determine if these strategies are effective? Monitoring is an essential part of any communication plan. This is how you measure your progress, identify problems, and make sure you're using resources effectively. As a sub-national or district manager, it is important to monitor communication efforts as part of your supervisory activities. It is also important to support health workers to monitor the work of community volunteers. Some questions you might answer through monitoring include: how engaged is the community in immunization activities? What impact are you having on caregivers' knowledge, attitudes, or practices? How effective are community mobilizers? What actions can be taken to improve communication and community engagement? To monitor communication and community engagement efforts, you will need to select indicators that you will measure, identify tools and methods to collect the data, plan for monitoring activities, and once you analyze the data, share the results. First, you will select indicators to measure your progress. An indicator helps measure progress towards a goal or target you have set for your program. Indicators are selected during the communication planning process for each planned activity. An indicator may relate to advocacy, social mobilization, or social and behavioral change depending on the focus of the activity. For example, your district may have a target of holding planning meetings with community members every 2 months in villages with low coverage rates. The indicator for this target would be the proportion of villages with low coverage that actually held planning meetings in the last 2 months. Notice that this is a strong indicator because it is easy to understand, based on data that can be easily collected, and is possible to improve through specific actions. Remember, you will need to integrate your communication indicators into existing EPI monitoring forms and processes so that they are collected and analyzed along with other monitoring data. Then, identify the tools and monitoring activities for collecting data. Consider which tools might help you collect data during supervisory visits and routine monitoring. For example, this checklist can be used to track the activities and effectiveness of community volunteers and evaluate communication between the vaccinator and a caregiver during a vaccination. You might include questions in a monthly report or pull from data that is already collected in reports and facility records. You might also conduct exit interviews, household surveys, and focus groups with community members to see if they received and understood key messages. You would also monitor media channels for consistent, accurate messages about immunization. As you consider these activities, include any training that health workers will need to monitor community mobilizers and volunteers. Next, you would develop a plan to carry out these activities. Monitoring activities should be part of your overall communication work plan. Include activities for collecting, analyzing, and disseminating data as well as training. And for each activity, identify the frequency or time frame, the staff responsible, and the resources needed. As manager, you will need to make sure these monitoring activities are carried out as planned. Once you have collected and analyzed monitoring data, share results with key groups. Provide feedback on communication activities to facilities as part of your ongoing supportive supervision. Also, share challenges and successes with the public through community meetings, religious and community leaders, and partner organizations. Ask for ideas to improve services and communication. Finally, share monitoring results with central levels through routine reporting. Include successful efforts that could be duplicated in other districts and as well as challenges that may require additional resources. Remember these key steps for monitoring communication and community engagement activities.